Welcome to the Southeast Asia Science Advice Network, or CSAN, Eminent Speaker Series Lecture on Planetary Health. I'm Jamie, the Research Coordinator for the CSAN, and I will be your MC for today. Before we begin, please join me in inviting Pangsiri Professor Dr. Zakri Abdul Hamid, the Chair of the CSAN, and also the former Science Advisor to the Prime Minister of Malaysia, to deliver his welcoming remarks. Welcome, Tan Sri Zakri.
Thank you, Jamie. Good morning, good afternoon, and good evening to all our friends, colleagues, and participants of this webinar. As Jamie mentioned, this is the Eminent Speakers series launched by the Southeast Asia. Hello, can you hear me? Hello?
Yes, Pangsiri, we can hear you.
All right. Southeast Asia Science Advisory Network. Just to give some background, the Southeast Asia Science Advisory Network is part of the bigger undertaking called INGSA. This is the International Network for Government Science or Scientific Advice, INGSA. Ladies and gentlemen, INGSA is the bridge between the knowledge generators, like many of us scientists, to interact, to link with society and public officials, politicians, or policymakers. As we can see, there's a lot of knowledge within the academic community, but there's less connection between that scientific community and the public and the policy makers. So that is the context of the INGSA Southeast Asia Science Advisory Network. INGSA was formed in 2014 in Auckland. Its first chair is Sir Peter Gluckman, the former science advisor to the Prime Minister of New Zealand. It happened that I'm one of the founding members of INGSA. And in 2020, we established CSAN to undertake whether this platform of science and policy could be realized in a practical way. We are actually indulging in what is known also as CEPA, communication, education, and public awareness. And as the recent COVID-19 episode showed us, this kind of platform is very much needed. So we are very fortunate today to have Dr. Montira Pongsiri. Dr. Montira Pongsiri is a very experienced and a leader in public health worldwide. I've known her for quite some time, even when she was angling, I think, one major project in Latin America in public health. And we reconnect again, and I'm sure her rich experience will give us some insight into the problem on how to realize public health. We are also fortunate to have Dr. Renzo Guinto from the Sunway Center for Planetary Health, a very new center at Sunway University, anchored by Tan Sri Jamila Mahmud. Renzo and Tan Sri Jamila are close collaborators. So I just want to welcome all of you. I hope this is the beginning of more eminent speaker series, which could demonstrate to the global community on the effective need for this bridge between scientists and the policymakers. Jamie, with your indulgence, since Prof. Abi is also here, I could invite Prof. Abi to give 3 minutes of your wisdom. Provost Abi is from Sunway University. He's also the president of INGSA Asia chapter, one of 3 chapters in the world. Abi, you have the floor. Yeah. Sorry, Jamie. Okay. Thank you.
Welcome, Prof. Abi.
Yeah, so part of the opening act before, of course, the main reason we are all here today, is to hear the forum that Dr. Renzo is going to be moderating with Dr. Montira. Tan Sri, thank you very much for a very kind opportunity to just speak to the audience today. So really, really excited. This is the inaugural CSUN Eminent Speaker Series. And as Tan Sri mentioned earlier, the reason why we are engaging in trying to promote this whole idea of science advice is because we understand today that the biggest challenges that we are facing are not necessarily those that are hampered by lack of scientific or knowledge or innovations, but perhaps the cultural acceptance, the ability to decide on decisions that need to be prioritizing specific resources over another, or even competition between countries, regions that may inhibit some of the larger visions we have as a collective world. So the whole idea for science advice is to appreciate that there are competing interests, not just the science and knowledge, but also various different other interests that we might have that competes with the utilization of this knowledge. But how might we better as a society, as a government, as a community, a global community, work together to use scientific information and the knowledge we have to better inform decisions that are for the benefit for all? And that's what INGSA has been doing. It's about building partnerships. It's about making people who perhaps in the past were not aware that the science doesn't speak for itself. The science needs agents like yourself to broker it, but also to make our policymakers, the demand side, to understand the value of working with the academia and the various different stakeholders in curating policies that are for science, but also ensuring that the science is for the policy. So I'm not going to say a lot more than please invite you to go onto our websites, the CSUN website, the INGSA Asia website, because there are a lot of resources that you can leverage upon, as well as a lot of connections that you can build. INGSA is 100% not-for-profit, it's voluntary as well. So which means that your membership does not cost you anything. So just register, and then you can be part of that communication network that we are creating. Thank you, Tan Sri. And I pass it back to Jamie.
Thank you, Professor Abi. And also thank you to Tan Sri. So without further ado, ladies and gentlemen, let me just brief you regarding today's program. We will start with a 40-minute lecture, followed by 30 minutes of discussion and question and answers. So we hope that during the lecture, you can start to think about any questions you may have, and we can discuss them during the Q&A session. So now, please allow me to introduce our speaker for today, Dr. Montira Pongsiri, and also our moderator for the discussions and the Q&A, Dr. Renzo Guinto. Dr. Montira was the first science advisor at the US mission to ASEAN, where she led efforts such as the ASEAN-US Sustainable Cities Program, Sustainable Cities Partnership, and the ASEAN-US Science and Technology Fellows Program. She was an environmental health scientist at the US Environmental Protection Agency Office of Research and Development. She led partnerships with the Smithsonian Institution and the Rockefeller's 100 Resilient Cities Global Challenge, and she served as a member of the Rockefeller Foundation-Lancet Commission on Planetary Health. She has worked at Cornell University and the University of Oxford on planetary health science policy, and consulted on global environmental changes and health, including with the UN agencies in the Asia-Pacific region. She is currently the science advisor on climate change and health at Save the Children's US office in Washington, DC, and also a council member of the CSUN. Thank you, Dr. Montira, for joining us here today from the US. And of course, Dr. Renzo is the Chief Planetary Health Scientist and Associate Professor of Public and Planetary Health at Sunway University. And he is concurrently an Associate Professor and Inaugural Director of the Planetary and Global Health Program in St. Luke's Medical Center, College of Medicine in the Philippines. He is an Obama Asia Pacific Leader and Aspen Institute New Voices Fellow. He sits on several international boards, including the Lancet Planetary Health, Global Health 50/50, Climate Cares, Lancet Commissions on One Health, and Population Health post-COVID-19 in collaboration with various institutions such as University College London, Imperial College London, and the University of Cambridge. Thank you for being our moderator for today, Dr. Renzo. So now, please join me in inviting Dr. Montira to deliver her lecture. Welcome, Dr. Montira.
Thank you, Jamie. Can you hear me? Can you just give me an indication that you can hear me?
We can hear you and we can see your slides.
Thank you very much. I'm Montira Pongsiri. Many, many thanks. I'm very grateful to Professor Zachary, Abi, and Jamie for very nice, generous introduction and the invitation to speak in this series. It's really my great honor. I think what we all have in common is really an interest in mobilizing science for impact through informed decision-making, policy, advocacy, and solutions on the ground. How we do this is just as important as achieving that impact of solutions on the ground. So what I'm going to do today is to present planetary health, which is, to me, the foundational framework of environment and health nexus issues that we face today. And increasingly, planetary health is the foundation of how organizations such as my own are operationalizing programming, evidence-based policy, and advocacy. I'll focus on one example of planetary health, the relationship between climate change and health. Then a systems-based approach to address planetary health and the value of doing so. I'll then present a case study in Southeast Asia on land use change and fire emissions. And then finally, I'll talk about operationalizing a systems approach to planetary health at my own organization, having established a climate and health program now a year and a half in. So what is planetary health? Put very simply, planetary health is the health of human civilization and the state of the natural systems on which it depends. Planetary health was highlighted in the 2020 Human Development Report, which recognized that human-driven changes such as climate change, land use change, and the loss of biodiversity are really a distinguishing feature of this Anthropocene era, in which human activities are simultaneously impacting Earth systems and socioeconomic trends in interconnected ways. Planetary health says that unless we dramatically change the way that we currently use our natural resources, we risk the health of human civilization. So planetary health makes very explicit the state of our natural systems, like our climate, our forests, our oceans, in implementing health. Traditionally, from the health sector, the global health and public health agendas don't generally consider whether health improvements were made at the expense of compromising the functioning of our natural systems. I was privileged to be one of the members of the Rockefeller Foundation-Lancet Commission on Planetary Health between 2014 and 2015. The commission report's key message was that while we made significant gains in health and development over the last 50 years, they're likely to be reversed by the unprecedented global environmental changes like climate change and land use change, which we are now experiencing. The second key message is that importantly, there is agreement that reversals could be mitigated or minimized if the drivers and consequences of global environmental changes are understood, and this understanding is reflected in policy and planning. When the Commission started its work in 2014, we were first struck by the really significant measurable gains in human health made over the last half century. Population has increased, absolute poverty has declined dramatically, although we now have a caveat of COVID and the pandemic that has helped to reverse somewhat that trend. Underage 5 mortality over the last 50 years had been more than halved. Life expectancy went up dramatically, but at the same time, over this last half century, we've exploited our natural resources. We've used our energy and water in an escalating way. We've deforested in the tropics. We've experienced profound water shortages. We've acidified our oceans, and we've experienced parallel changes in temperature, some 0.85 degrees since the 1850s. That's been accompanied by a rise in greenhouse gases, many at higher levels that have been experienced for 800,000 years. And we've lost our biodiversity at 100 times the background rate. These global environmental changes are represented in these graphs by Will Steffen et al. They're also known as the Great Acceleration. They support what Nobel laureate Paul Crutzen proposed in 2000, that we've entered a new geological epoch, the Anthropocene, which is characterized by the impact of human activities on the Earth system. So these graphs show comprehensive, interlinked long-term trends from 1750 to 2010, trends that are simultaneously happening across socioeconomic and biophysical spheres of the Earth system. And they cover much more than climate change. You can see here that just since 1950, the human population has almost tripled. Real global GDP has increased by more than 7 times. Freshwater use has increased by 3 times. Primary energy use by 5 times. Fertilizer use by more than 10-fold. And this human activity has had profound impacts on Earth systems. Rising levels of greenhouse gases, a warming planet, ocean acidification, and alarming losses of fisheries, forests, and biodiversity. So Steffen and his colleagues expected to see a growing impact of human activities on the Earth system from the start of the Industrial Revolution and on, but they didn't expect to see the dramatic change in the magnitude and rate of human activities from 1950 onwards, what they call the most rapid transformation of the human relationship with the natural world in the history of humankind. These impacts on Earth systems are really, really dramatic. So why do they matter? They matter because the ecosystem services literature shows that we derive benefits, direct and indirect, from healthy natural systems like our climate, oceans, rivers, wetlands, and forests. These benefits include the provision of our fuel, fiber, food, safe water, the regulation of our air. The WHO recognizes that healthy natural systems are the platform for good health. So the unprecedented global environmental changes we are experiencing, which we are causing, such as climate change, has the potential to disrupt the progress of humanity because of these impacts on critical ecosystem services. Again, the provision of our food, safe water, and clean air. These are some, let me give you a few salient examples of the types of planetary health relationships that we're concerned about. This is not a complete list. I'll talk later about climate change and health, specifically in the Southeast Asia context. For now, let me just point to some direct and indirect health effects of climate and environmental changes we're seeing globally. One direct effect global environmental change on health is heat stress. As we've seen this year and in recent years, especially in North America and in Europe, which have not commonly experienced it, climate change leads to extremes in temperatures and higher temperatures, which cause heat stress and other temperature-related illness and death. Every year, higher temperatures affect the health of many people, especially infants, people who work outdoors, the chronically ill, and older people. This figure shows global heat-related mortality in the population over 65 over the last 20 years. People living in the tropics will be especially at risk because by 2050, half of the world's population will live in the tropics. Rising temperatures and humidity will make the tropics increasingly unlivable by pushing more people to the limits of their physical tolerance. Another important indirect health effect of global environmental change, such as biodiversity loss, is very obvious in the Southeast Asia region. By 2030, overall biodiversity is projected to decline due to the loss, degradation, and fragmentation of species habitats due to overfishing, pollution of waterways, invasive species, and climate change. The important health risks associated with biodiversity loss are the loss of wild foods, like fruits, plants, and herbs that contribute to dietary diversity, as well as the loss of nutrient-rich subsistence fluids, such as fisheries. Another important health effect of biodiversity loss is the increased risk of infectious diseases like malaria and Nipah virus, related changes in the abundance, composition, and distribution of animal hosts and vectors of disease. In the last 40 years, Southeast Asia has lost 30% of its forest cover. Demographic growth in Southeast Asia has put a lot of pressure on land use for farming, logging, and hunting. And through these changes in biodiversity in our ecosystems, people are coming into closer contact with infected animals and at risk of disease spread. Moreover, biodiversity loss results in the lost potential for the discovery of new medicines from plant sources, which has a long history in Asia. Wanted to mention another aspect of biodiversity loss that's relevant to planetary health, because biodiversity also includes the variety of terrestrial and other ecosystems. Their loss can lead to psychological and emotional outcomes. Green spaces can promote physical and mental health and reduce morbidity or mortality of urban residents by providing psychological relaxation, stress alleviation, stimulating social cohesion, supporting physical activity, and reducing exposure to air pollutants, noise, and excessive heat. A systematic review of benefits to health from exposure to natural environments reported that significantly lower negative emotions such as anger and sadness were experienced after exposure to natural environments compared to synthetic environments. A 2019 systematic review and meta-analysis of adult cohort longitudinal studies found that increasing increments of residential greenness are significantly associated with reducing all-cause mortality. What hasn't been widely studied that concern the Planetary Health Commission is the effects of multiple environmental changes together on human health. Most studies focus on one driver of environmental change. This slide points to the many environmental factors affecting food availability and food quality. But we really need to understand better how these factors work together. The concern is the potential for adverse, negative, synergistic interactions. Another issue that was raised by the Commission is that environmental change can increase inequities. This graph illustrates the idea of an ecological transition, whereby populations replace natural infrastructure that had provided services or benefits like food provision, safe drinking water, fuel, and fiber. When populations replace this natural infrastructure with engineered infrastructure and markets, this transition can be associated with health benefits for most people who are able to make this transition successfully. But poor populations are increasingly vulnerable as their natural infrastructure is degraded. Their poverty prohibits them from accessing the benefits of engineered infrastructure or markets. So this highlights an important environmental justice, intergenerational equity issue, in that most of the burdens associated with increased degradation of natural systems will be experienced by the poor and by future generations. Planetary health is contributing to the body of seminal reports, which pay attention to elucidating the health impacts of global environmental changes, while recognizing that this understanding has to be translated into country and local level actions. Some of you may be familiar with One Health. Similar to One Health, Planetary Health provides the holistic lens needed to improve understanding of how global environmental changes impact human health. Similarly, Planetary Health is a framework for developing strategies to not just reduce, but prevent risks to health by strategically addressing those upstream human-driven environmental drivers of health, rather than address or treat the health consequences alone. The opportunity to improve and to sustain health by enhancing our stewardship of natural systems and by reducing our current exploitative use of resources linked to unsustainable consumption and production patterns is a new concept in global health and medical practice. So let me talk in more detail about one planetary health example: climate change as a driver of human health. At current rates of warming, there is at least a greater than 50% likelihood that global warming will reach or exceed 1.5 degrees above pre-industrial levels in the near term, even for the very low greenhouse gas emissions scenario. 1.5 is considered the threshold beyond which the worst catastrophic impacts of a changing climate will happen. The most recent IPCC report on climate change from earlier this year found that global warming is reshaping the world more quickly and severely than was known just several years ago. Climate change is affecting every person's physical and mental health, and nearly half of the global population is classified as being highly vulnerable to climate impacts. The report warns that climate change impacts will occur simultaneously in ways that may be hard to predict and result in unintended consequences. These unintended consequences include disproportionate adverse impacts on underprivileged groups, such as children, women, and the poor. Addressing the health impacts of climate change is really critical because climate actions like climate adaptation and climate mitigation, these are the two main climate actions. And those actions planning by countries cannot ignore health. Doing so could result in trade-offs and unintended consequences, which could ultimately undermine our well-intentioned efforts to improve health. Climate change has the potential to disrupt the progress of humanity because of its impacts on those critical ecoservices, such as the provision of our food, safe water, clean air on which we depend, and because of its potential to exacerbate already existing socially mediated risks, such as displacement and limited access to essential health services, including family planning, sexual and reproductive health, in all settings, humanitarian and non-emergency. This figure from Smith et al. Shows the health impacts from climate change. Some effects from climate change are direct. As I earlier mentioned, climate change leads to extremes in temperature and higher temperatures, which cause heat stress and other temperature-related illness and death. But some health effects from climate change are indirect. Climate change can affect the severity of monsoon flooding, for example, now in Pakistan. In some years, flooding is more intense and exceeds the capacity of communities to deal with it, leading to deaths and destruction of important infrastructure, homes, and livelihoods. Another indirect health effect of climate change is from air pollution, a major problem globally. The combustion of fossil fuels, primarily coal, petrol, and diesel, for electricity generation and transport, is the primary cause of climate change, and at the same time generates air pollutants like particulate matter, PM 2.5, which is the strongest and most consistent predictor of mortality from long-term exposure to air pollution, as seen in the figure. The impacts of air pollution fall most heavily on children, women, and the poor. Some health effects of climate change are ecosystem mediated. Increases in global mean temperatures, especially in tropical areas, will result in lower crop yields for wheat, rice, maize. And this is associated with more drought-affected areas. And this has attendant consequences on stunting and malnutrition in children. In addition to the negative impacts on food security, climate change affects the quality of our foods. For example, higher concentrations of atmospheric CO2 can lead to significant reductions in the amount of zinc, iron, and protein in grain crops like rice and wheat. Not only, though, do increasing concentrations of CO2 induce deficits in zinc, iron, and protein, but also in important vitamins like B1 and folate in many rice varieties grown in Southeast Asia. So climate change poses a nutritional insecurity issue for communities in Southeast Asia as well. And another important ecosystem-mediated health effect of climate change is the risk of vector-borne diseases. From changing rainfall patterns, which could increase potential breeding sites for mosquito vectors. This is the current and future global distribution and population at risk of dengue. A changing climate could shift the environmentally suitable geographic range of disease-carrying Aedes mosquitoes, vectors for dengue. Vulnerable groups for dengue include children, pregnant women, the elderly, and those with limited access to health services. One major climate action is adaptation by strengthening health systems to better manage vector-borne diseases by linking weather data for rainfall, temperature, and reported disease case data to be able to track these linkages to prepare for and treat disease. And then there are the long-term mental health impacts, such as depression, associated with climate change-related displacement and migration. The new IPCC report from this year notes that mental health impacts are mainly coming from trauma related to extreme weather and climate events, such as wildfires. But while the mechanistic causal pathways are not yet well characterized or quantified, the mental health impacts may be among the most important over the long term. There is variation in the most concerning health impacts of climate change within and across countries and regions. Climate-sensitive health impacts will vary by age, gender, income, livelihoods, and ability to deal with the challenge. So I've talked about the direct, indirect, ecosystem-mediated, and still unknown pathways by which a rapidly changing climate can affect health. This complexity of pathways makes the attribution or determining cause and effect of health outcomes to climate change difficult, and therefore can make interventions challenging to develop and to implement. The magnitude of climate-sensitive health impacts depends on the climate actions taken now. So there is urgency. This figure shows that climate change interacts with social determinants such as poverty, limited access to health services, housing conditions, access to clean water. They interact to affect health. Some of these social stressors are modifiable, like poverty, access to health services, level of education, living conditions. And so because they are modifiable, they are targets for intervention. So strategy should focus on practical approaches to effectively sequence, to layer, and to integrate interventions that address the range of context-specific factors contributing to adverse health outcomes, from those upstream drivers such as climate change and increased exposure to natural hazards, whether it's drought, floods, fires, to the underlying structural inequities, like unequal access to infrastructure, social services, to the more immediate consequences of increasing stress on scarce natural resources, for example, conflict and displacement. So there's a continuum of interacting factors that will affect health as a societal outcome that we should be targeting. Climate change increases inequities. The risks to health from climate change are the product of the nature of the hazard. Heat, drought, or floods, the extent of exposure to them, and underlying vulnerability. Vulnerability depends on factors such as existing health status, socioeconomic status, and access to health services. These vulnerability factors are further compounded by inequalities associated with social factors related to gender norms, roles, and relations, ethnicity, race, and disability. How you conceptualize the problem determines how you address it. So for me at Save the Children, climate and health is a climate, health, and equity challenge. Let me put climate and health in a climate justice context. Climate justice draws attention to the equity dimensions of climate change. Who has caused it? Who will suffer from it? Who can cope with it, and how? So climate justice frames these issues as an ethical and a political issue, recognizing that climate change can have different social, economic, public health, and other adverse impacts on underprivileged groups. Applying the concepts of climate justice and health equity provides a critical lens for how we can address climate change and health. I'd like to talk about a systems-based approach, which I think is key to addressing complex problems like planetary health. Systems thinking attempts to understand a whole system rather than its parts. It's used to identify the most effective leverage points to stimulate change, positive change within the system. Systems thinking helps us to see the difference between the root causes and symptoms of problems. It's the system's understanding that holds the solutions to complex problems like planetary health. In the climate and health context, we have to recognize that many determinants of health fall outside of the health sector's responsibilities, such as activities in energy, transport, agriculture. These activities contribute to climate change and at the same time affect health. So the relationship between climate change and health can be nonlinear. It can involve time delays and feedback interactions among many factors, socioeconomic, and across many sectors, as I mentioned. This complexity can lead to health outcomes that are hard to predict and result in unintended consequences, including disproportionate adverse impacts on certain underprivileged groups in the present and over time. As a result, a multi-sectoral systems-based approach is needed to address climate and health. A systems approach to climate and health helps us to see that big picture, to integrate knowledge from different sectors and disciplines, and help us to understand interconnections so we can identify root causes that we could target for positive change while minimizing the potential for adverse consequences. The key to operationalizing the systems-based approach to climate and health is the integration of knowledge, as I said, on climate, its health effects, and social and other determinants which affect their relationship. This knowledge integrated into tools is needed to support how we assess vulnerability, how we monitor changes in environmental conditions and what they mean for health. Tools that can help us to forecast changes of changing environmental conditions, and tools that can help us take cost-effective actions to reduce health risks of human-driven environmental changes. This figure is specific to my work at Save the Children, but you can see generally that the systems approach highlights the need to understand the interconnections between drivers of climate change, its impacts, any feedback relationships, which could amplify the negative impacts on health. So we need to understand if there are disproportionate impacts of climate change on underprivileged groups, and if so, how and why. Do social factors contribute to this relationship? Do they exacerbate the health impacts of a changing climate? And if they're modifiable, are they feasible targets for interventions? We have to ground this understanding in a decision-making context, while at the same time engaging stakeholders in the community members themselves, civil society, academia, policymakers, advocates, influencers, to build a shared understanding of the problem in context. Together create a shared vision for that community's future and co-design interventions and implement them together. Let me briefly share a case study where a systems approach is applied. The Planetary Health Commission pointed to the importance of landscape fires. Landscape fires from open burning cause approximately 300,000 premature deaths every year and contribute to the 4 million premature deaths from outdoor air pollution globally. These are preventable deaths. In 2016, we published a paper which estimated that approximately 100,000 deaths across Singapore, Malaysia, and Indonesia were attributed to those 2015 fires. These are deaths which otherwise would not have happened if not for those fires that year. 2015 was an El Nino year, which created drought conditions, which dried out the peatlands where most of the fires are set. Peat is composed of rich organic matter, and with the drier conditions provided abundant fuel. So the intensity of the fires was greater and the fires burned longer. I worked with a multidisciplinary team of scientists who studied the relationship between land use, fire emissions associated with land cover change, their transport by winds towards population centers, and what we know epidemiologically about the relationship between exposure to particulate matter in those fire emissions and human health. The integration of these data across different disciplines resulted in the development of an innovative modeling tool which quantifies the human health impacts of specific fire events. Later in 2016, we engaged with the government of Indonesia's Peatlands Restoration Agency, which had a mandate to protect millions of hectares of peatlands. They saw the opportunity to build a stronger science base in human health terms, to plan for which peatlands to protect so that where fires were avoided, they could also avoid the greatest human health risks downwind. The same health and economic costs and benefits of peatlands protection could support the evidence base to strengthen climate change mitigation strategies globally, such as peatlands and forest protection. So this is an example where actions from the non-health sector could yield multiple benefits for climate and for health. Of course, the problem of biomass burning is more complicated, but a systems understanding could inform a holistic set of interventions which together can protect or at least minimize harm to health, to peatlands and biodiversity that are threatened by the fires, while reducing greenhouse gas emissions and supporting farmers' livelihoods. This figure, developed with my colleague, Dr. Andrea Bassi, shows a systems map. This is really messy, but what I want you to take away from this figure is how variables are connected can provide a shared understanding which can lead to revealing root causes and potential intervention actions which can benefit climate and health. So let me summarize the systems map. Palm oil demand drives land use clearance by fire. In addition to forest loss and use of resources for fire response, there are other measurable societal impacts of landscape fires related to open burning. Open burning results in fire emissions and higher levels of particulate matter. Direct exposure to that particulate matter and higher levels, direct exposure to pollutants like particulate matter leads to adverse human health impacts such as cardiovascular disease and respiratory disease. These diseases pose societal costs such as increased healthcare needs, closed schools and businesses, and as a result, lost productivity. Environmentally driven risks to health are often clustered among socioeconomically deprived population groups, thus potentially interacting with other risk factors for ill health, such as lack of income or low level of education. So this presents a really concerning feedback loop in that deteriorating health resulting from air pollution can lead to greater health expenditures and or lower educational attainment and lower productivity, thus further contributing to growing socioeconomic inequalities. So investments in systems-based integrated decision support tools, which quantify the human health effects of exposure to PM 2.5 and fire emissions associated with land use clearance, could inform protection of forests and peatlands by helping us to prioritize planning for which land cover types to protect, and where the fires avoided could then help to avoid or prevent the greatest human health risks in nearby population centers. The same health and economic benefits and avoided costs could be used, again, to strengthen climate mitigation efforts globally. Human health can be a lever for peatlands protection, policy prioritization. And at the same time, peatlands protection activities can also directly and measurably benefit health. The key to taking a systems approach, as I mentioned, is knowledge integration of climate, health, and social data. And this integration is meant to meet current policy needs for integrated assessment, for monitoring, forecasting, and costing of solutions to reduce health and well-being risks of environmental changes resulting from human activities at relevant spatial and temporal scales. This table shows the known decision-making needs and gaps, which we have to address to be able to address planetary health effectively. And these gaps were identified with colleagues from academia, UNEP, UNICEF, and UNDP, among other practitioners. So I thought it might be helpful to talk about an example of operationalizing a systems approach to planetary health, specifically climate and health, in an organizational context. These are the objectives of my organization's Save the Children strategy on climate and health: to sustain health, to target the climate drivers and social determinants of ill health that drive health inequity, to support a multi-sectoral approach to planetary health in an equitable way, and in so doing, support participatory community engagement for improved and good governance. So at Save the Children, as I mentioned, we define climate and health as a climate, health, and equity challenge altogether. There are 5 key barriers to addressing climate and health and equity together. So we developed an organization-wide strategy and programming organized around overcoming these barriers, to overcome limited awareness that there are common drivers of climate and of human health. We want to improve understanding of the multisectoral impacts of climate change and the contributing social determinants of health, to overcome inadequate recognition of co-benefits of actions on climate and health. We want to work with communities to foster community actions to identify, test, and scale interventions with climate, health, and equity benefits. To overcome those decision-making silos, we want to support multi-sectoral governance through the use of integrated data and decision support tools. And to further improve governance, we want to strengthen the skills and leadership capacity of communities to engage in the co-design and co-implementation of interventions and actions. And to overcome inadequate resources, both human and financial, we're trying to develop multiple benefits-based advocacy and tools for private and public sector engagement. Some of the impacts that we're looking from in our work on climate and health include these: stronger health systems with the capacity to track, to plan for, and respond to climate hazards. We want to support communities with the capacity to prioritize themselves, their climate and health risks, and to take evidence-based actions to address them. And we want to support the development of national and subnational plans which reflect an understanding of climate and health relationships. Through this, we want to elevate and amplify the voices of children and youth and other disadvantaged groups. We want to do this in advocacy and through policy discussions at multiple levels. This is not meant for you to read, but I wanted to mention that there is coherence in climate and health programming. And that's been important to us so that all of our activities on climate and health contribute to the emerging and developing evidence base to advance our understanding on climate and health for all stakeholders. Save the Children's Climate and Health Strategy has that coherence through these key research and learning questions. These are some of them. And these need to be addressed to overcome those 5 key barriers I mentioned to address climate, health, and equity together. So we use these research and learning questions for the design, implementation, monitoring, and evaluation of all of our activities. These are some of the priority programming on climate and health at Save the Children. They include anticipatory action, which means to be able to link early warnings of changing environmental conditions for health, to take actions to be able to address food and nutrition insecurity, for example. We're interested in working with others to develop and testing and scaling nature-based solutions for health and for climate. And we want to work with communities who lead sustainable urban design. And in all of these projects, youth and gender engagement are going to be a common theme. Let me give you just a few examples before I end on some ongoing climate and health projects at Save the Children, where we are taking that systems-based approach. In Lao PDR, we're working with the government's Ministry of Health and Ministry of the Environment, Department of Climate Change, to produce early warnings of vector and waterborne diseases such as dengue and diarrhea disease. This climate adaptation strategy of strengthening health information systems goes with climate mitigation, because we're also supporting the government's efforts to reduce greenhouse gas emissions from healthcare facilities, including their supply chains. And I wanted to end with questions for you. Are there opportunities now to elevate planetary health through existing or in development country activities, which together could have positive region-wide impact? Can we do this by explicitly addressing environmental drivers of health? What specific types of multi-agency or multidisciplinary partnering can be built on to engage now on planetary health? Are there good models you've worked on or developed on community engagement to build a shared understanding of planetary health to inform policies and actions? So I'd like to end there, but also thank you very, very much for your kind attention. I think I'll turn it over to Jamie or to Renzo.
Thank you, Dr. Montira. I'll pass my mic now to Dr. Renzo so that he can moderate and facilitate the discussion and Q&A.
Thank you very much. Thank you very much, Jamie, and thank you, Montira. Wow, that was such a gift that you have just given to us here in Southeast Asia, and really you were able to summarize and cover such a very broad theme, you know, of planetary health in such a very compelling way through your presentation. Very briefly to our audience, again, I'm Renzo Guinto. I'm the Chief Planetary Health Scientist of the new Sunway Center for Planetary Health based at Sunway University. It's the youngest or the newest kid on the block in the Sunway family. And it just shows the commitment of Sunway University and even the Sunway Group to planetary health, to tackling some of the challenges that Montira has laid out through her presentation. You know, Montira, you mentioned that Southeast Asia is indeed at the heart of the planetary health crisis. You've described the impacts of climate change on the health of people here in the region and, of course, globally, biodiversity loss, and even the likelihood of a future pandemic emerging from this part of the world if we do not get our acts together. And that's why the Sunway Center for Planetary Health is very committed to addressing these planetary health challenges, to advancing planetary health research, education, and practice. And it's funny because we're supposed to be asking you questions during this session, but in the last slide, you actually gave us questions to ponder about. You know, you would describe it as a research and learning agenda, which the Sunway Center is taking very seriously. We've identified several priority areas, including climate change and preventing the next pandemic, and achieving sustainable food systems and redesigning cities into ones that both protect the environment, but at the same time make people live healthy and happy lives. And we also at the Sunway Center are very, very committed to improving governance for planetary health. Maybe we can talk a bit about, you know, governance as well, especially because this is organized by INGSA and CSUN, which is committed to enhancing that, you know, academia government link, you know, that evidence to policy, you know, trajectory and translation. I think we need to be very, you know, to be very committed and devoted to making sure that the knowledge that we generate really gets translated into policy and governance and make a direct impact on people's lives. And finally, here in Sunway University, we are actually educating the next generation of planetary health leaders and citizens. This year, we just launched a core course entitled Community Service for Planetary Health. And the dream is that that course will be made available to all students of Sunway University, regardless of discipline and profession. You can be an accounting student, a culinary arts student, an engineering student, a nursing student, but everybody has a baseline competency in planetary health because we need to increase our tribe sooner rather than later. We have urgent deadlines that need to be met when it comes to the health of both people and planet. So I'll stop there, and maybe we have some questions from the audience, and I am seeing one from the chat box. I encourage everybody to please maximize this opportunity that we have to interact with Montira. The question from Menaka is, what are the challenges and barriers faced by big industry players in championing planetary health? Overall, how are they playing this role? And maybe just to provoke the discussion a bit, are we seeing companies doing green or planetary health washing? Or are we also now seeing companies that are truly devoted to planetary health? Montira.
Thank you, Renzo. And thank you, Menaka. Great question. And this, you know, there's a deeper problem that we had to face when we were trying to characterize this problem called planetary health, which is that, as I mentioned, you know, over just a short amount of time, we've made very significant health and development gains, but we've done it at the expense of exploiting our natural systems. So you have to think, you know, how are we growing? Can we grow differently? What are the models for growth for the future? How do we reimagine prosperity? So the partnering with the private sector, as you suggested, is going to be very important because changes will have to happen in practice at a very big scale. And they could also help to lead that change if we can bring more of them into our chorus. So I wish I could give you a lot of good examples of private sector engagement. But I think as we are trying to partner with the private sector, we need to think about that growth model and metrics for change that benefit both natural systems and health. There have been some really interesting, innovative development in tools, particularly in the insurance industry, as they are thinking about supporting clients who have lost property, livelihoods due to an extreme weather event. So there's an insurance instrument called index-based insurance, where, for example, a country could pay a premium and decide with the insurance provider on a set of parameters for conditions such as rainfall. And when those conditions and parameters are met, then it triggers an insurance payment right away. And that speed is what's critical, because the country that invests in that premium and helps to identify those parameters with the insurance industry can then take those funds and reinvest into their systems, whether it's a health system, to be more resilient. So the private sector, in my discussions with them, are very, very interested in the climate health space on adaptation. How do we best manage the risks, the health risks that we expect are coming, that we've seen, of a rapidly changing climate? So the investments that I've seen and that we are sort of pursuing now seriously with the private sector have to do with improving those health information systems. I gave you an example of health adaptation through health system strengthening. And there's a big focus in doing that through improving health information systems by linking rainfall data, temperature. A lot of people are interested in drought, but linking those to reported disease cases to see, are there linkages over time? Do we have an information system where we can actually monitor and track these relationships reliably? And if we can, that buys us some time to manage and prepare for those kinds of risks. I found that businesses, private sector, are interested in those kinds of investments in climate and health. But as I said, I think it goes much deeper, where we earnestly have to make the table a lot bigger with whom we talk about planetary health, because we are talking about solutions, not just about describing problems, which we're very good at doing, aren't we? But the key is, how do you then use that understanding to solutions on the ground, and do it in a way that is inclusive with communities who are meant to be the beneficiaries of our collaboration. So that's why I think community led solutions, but with public and private sectors, are going to be key. So perhaps forums like ours here can use that convening power to just start these discussions, because they can lead to really unexpected places and partnering, because we can be very, very creative about mutual benefits in the things that we do together.
Awesome. And thanks for highlighting the importance of working closely with the communities, because I think some people may be thinking, oh, planetary health, it's all about global issues, but global challenges are very much local in their manifestation, but also in terms of solutions. And that's why, as I mentioned a while ago, the planetary health core module that we're designing for Sunway is really anchored in community service. You know, how can we use our planetary health knowledge to serve our surrounding community, indigenous populations, people within our own backyard, and so that definitely resonates with what you said. And I also like your point regarding expanding, the table, and also really, going beyond the cosmetic. I think fundamentally the discussion that we should be having is how do we reimagine the current economic system that we have, which created the planetary health damage in the first place. We have an economy that encourages us or drives us to consume limitlessly and to emit carbon to the atmosphere, as if the planet that does not have boundaries. Now I have a question from Jake Brian Cortez from the Philippines. As part of multisectoral and systems-based interventions, what are practical and initial steps that clinicians can adopt in their practice to support planetary health? So now from corporations to clinicians, Montira.
That's a wonderful question. Thank you. And practitioners, clinicians have more and more become part of this movement. Some people call it a movement, a framework, a concept, but clinicians are critical because they are the front line with patients and communities who are seeking and needing care. So clinicians and medical people, healthcare workers, I would say generally, can help. Well, we can work with them, you, to improve understanding or share this understanding of what planetary health is. That our health does in fact depend on the condition of our natural systems. There's an interrelationship that we have to keep healthy on both sides. And by increasing that awareness, clinicians can help in their engagements with communities, with patients, can help raise awareness of needing to reduce or prevent risks from modifiable environmental factors. So everything under planetary health, I would say for the most part, is due to human-led environmental changes. And that's why this Anthropocene epoch has been rightly named. It means that the feature, what's new about this epoch is our own activities. And our activities have grown to the extent that we've actually affected our underpinning health system, natural systems. And fundamentally, we depend on them. So the more we increase that awareness and understanding, and the verse in which we talk about planetary health, then we can get to very quickly about reducing risk, preventing risk, particularly preventing risk. And then we can look forward to thinking about, in all of our work, how do we actually sustain health? You know, it's one thing to stop at one point in time and treat disease, but because we have there's this larger understanding of how we're interconnected with our Earth, there is the need now to really think very carefully about our sustainable prosperity and sustaining health through the protection and stewardship of our natural systems.
Thank you, Montira.
Thank you for the question.
Yes, thank you. And as a physician myself, early on in my medical career, I already realized that I cannot be only treating one kind of patient, which is the human patient. Now we have two patients, people and planet, because the planet is sick, that makes people sick, and therefore we clinicians certainly do play an important role in advancing planetary health. And just to also share some of the initiatives here in Sunway, the Sunway Medical Center Velocity is the first Malaysian hospital that joined the Race to Zero campaign last year at the COP26 climate negotiations in Glasgow. And that hospital made a commitment to be a climate smart, low carbon and climate resilient hospital in the coming years. So stay tuned. And the Sunway Center is closely working with the Sunway Medical Center Velocity. We have several more questions, and I understand that we have very limited time, but if we can extend for a few more minutes, I'm sure we're the ones blocking you from your much needed sleep, Montira. but this just shows the excitement of our colleagues here in Southeast Asia now hearing the powerful message of planetary health. I mean, the interesting thing about planetary health is it's so transdisciplinary. So now from clinicians all the way to law, there's a question about law and legislation. How does the concept of personhood for nature is possibly considered in planetary health discourse? I'm reminded of some discussions around creating a universal declaration for the rights of Mother Earth under the auspices of the United Nations. Should we be giving nature a legal, personhood or identity in the courts?
Thank you, Renzo. Well, I think the recent passing by the UN of a right to a healthy and sustainable environment is an enormous win for all of us, because it gives us more tools to promote not just the basic human right to that healthy, sustainable development, but it gives us legal tools also for the advocacy that's going to be needed to push our governments to pay attention, to make responsible decisions, and to keep the pressure on them. So I think that was a huge development. I was reading your statement as thinking about the human rights development that just happened. So we do have a lot of tools. I think what we need more now of, and you and your colleagues and this group here in the audience, I would welcome working with any of and all of you on case studies, whether it's at country level or at other levels, because here in Southeast Asia, and when I was working with ASEAN, we had the opportunity to work at country level, but I think we also needed to make the case of what we were doing for planetary health or sustainability science, that if done by multiple countries, could have a region-wide benefit and positive impact. And that can really help to not only address a regional challenge through a shared regional solution, but I think we have to show more now, case study by case study, how these solutions are designed, developed with communities, implemented and sustained with communities, and what happens over time. And I think that's where some of the work in planetary health is necessary going forward. We need implementation research. We need case studies to show how and why solutions work or worked or did not work and why not. And so there's a huge opening now, I think, for the generation coming up under Renzo's leadership, but for all of us who still want to contribute and work with you all to find those solutions that are so urgently needed now. So I would urge you to think about case studies, which is why I posed that first question. And maybe that can be a topic of a next discussion with the council and beyond.
Excellent, Montira. And your last remark about the next generation aligns with one question / comment here from Nur Firdos. Younger generation nowadays are vocal when advocating for changes, especially in relation to planetary health. I see this positive. I see this as a positive aspect of awareness raised involving the youth. How do you see their roles, their drives, their impact? The impact that they may have in the future. So maybe this is your chance to speak to the young people who are in the audience.
Renzo, thank you. And thank you for the person who tabled that question. I think that's going to be critical. And I think more and more funders and governments and communities recognize that critical role of youth and adolescents. I think we had mentioned, Renzo and I, the need for good governance. Good governance also means inclusive participatory engagement by vocal leaders. And so as part of what we're doing to support planetary health and specifically climate and health is to invest in leadership skills for effective community engagement by young people from the outset. So they have to help be the ones to define the problem in the first place. What are your climate and health priorities in your context? What do you want to do about them? How do you want to do them? How can we support you? But the community-led nature of the solutions that we need has to be in the fore. And what we do to support that happening also has to be a priority, which is why the leadership skills, advocacy, campaigning, technical skills, technical understanding, development, they have to go hand in hand. So that's one major effort for the long term that we hope we can invest in more and more over time, but with partners like all of you to do it most effectively. So thank you for the question.
Thank you, Montira. And maybe in the near future, we need more young people who are equipped with planetary health knowledge and leadership to even run for politics if we want to influence the policy and political realm to usher the transformation that we want to see. There's one last question, and maybe this is a very fitting question because we still live in the era of the Sustainable Development Goals. We have 8 years remaining. Unfortunately, I don't think we will be reaching the goals, but we still have to do whatever we can in order to at least bring us closer to the finish line. Sadly, COVID-19 derailed progress in terms of achieving many of the SDGs. The Sunway University is very blessed to be host to not just a Center for Planetary Health, but also a Center for Sustainable Development. And one of the main questions that we've been constantly asking ourselves is, what is the connection between the SDGs and planetary health? So any thoughts on this, and how can we take advantage of the SDG moment in order to transform planetary health?
Great question. And my hats off to Sunway for aligning with these major global initiatives because it's very needed. The SDGs are, I think, a very positive platform for thinking about sustainable development pathways. Planetary health puts health in the center, but it also draws linkages, very clear linkages to natural systems. And so I think that in discussions with countries or with multilateral organizations who still have the SDGs kind of front and center, and I think that's, we've been distracted a little bit from that during the pandemic. If you can describe how planetary health brings coherence to the SDGs, that there are multiple benefits to reach those targets, SDG targets and goals, by at least conceptualizing issues under the planetary health context. I think there's resonance there. The coherence is what is important, because the SDGs can be complicated. There's many different goals, but the brilliance in them is that they are interconnected. And I think planetary health brings that interconnectedness by highlighting and making very visible that health is at the center to our health and well-being. But that's my bias. I'm an environmental health scientist, but it does raise that visibility of the health and natural systems interconnection.
Amazing. Montira, it's been a pleasure having this conversation with you. I remember the first time we met was 5 years ago, 2017. I was still a doctoral student. We were at the Rockefeller Foundation talking about and discussing about the future of planetary health. And 5 years later, we have a Sunway Center for Planetary Health here in Southeast Asia, and more are yet to come. So thank you. We look forward to more conversations and we hope to also be able to welcome you physically here in Sunway in Malaysia, in Southeast Asia. Thank you very much, Montira. Thank you to the organizers. And I give back the microphone to Jamie.
Thank you very much, Dr. Montira, and thank you so much, Dr. Renzo, for the wonderful discussions. So we are really, really fortunate to have had the opportunity to listen to both of you speak and to interact with you today. Before I end, I would like to thank the Sunway Center for Planetary Health, the Sunway Jeffrey Sachs Center for Sustainable Development, the Sustainable Development Solutions Network Asia chapter, which is also being hosted at Sunway, and also, of course, the INGSA Asia regional chapter led by the Provost of Sunway University, Professor Abi. And to all of our participants, thank you so much for joining us here today. We have prepared a short feedback form that would only take 3 minutes to fill, and we appreciate if you can share your thoughts with us so that we can improve for future events. Thank you, and we hope to see you again.
Bye, everyone. Have a good day there. Thank you, Jamie and Renzo and Professor Zachary and Nabi. Thank you.
Yeah, thank you so much, Montira. Thanks, Renzo.
Thank you.
Thanks, Jamie. Cheers.
Thank you, everyone.
And thanks to all participants. Thank you.
Thank you, everyone.